See there ya OJ card for and send ya you folder there, so back to the manual system. So the first one kwa near search for folder near there no to be to meet. After we are most charge you 10 Ghana cedis because a manual system and you have to pay 10 cedis. A lot of people in penifo ye biwo infear the okno, infear the watching, infear the son any and
Asemaba aha Ghana Sent TV best say we subscribe to the channel and for my being children comment section. The Ghana health system, President John Dramani Mahama, any akando. I am my dream pain say, best say BBR. I was see how many can say, Uko hospital. Folder, we are back to folder system. Uko hospital and near Udi, Yarifoko hospital, Ghana hospital and now. We are back to folder system. Nankaneno. President Nana Danko Akufo-Addo Dr. Mahmoud Bawumia time. Now this folder system now I over. Uko hospital would you Ghana card and I say health insurance no kwa back na ya ye bibi ama. But since many ukase uko Ghana hospitals abusia we are back to folder system. Yes, I have folder no ma we are we say you are 10 cedis. And as you won't go far, folder no say 3 hours, 4 hours. I folder na nankofono folder no. Question Ghana for the brave say. So is this the country that Nana Danko Akufo-Addo has handed over to President John Dramani Mahama? Is this what they are about to do? Abusia, now media I'm not surprised because this NDC government. Say every good thing NPP they want to kill it. Say go no. Yebekaya at a most time now for the national health insurance and buy no. At a must catch the Ghana for say or no bar or the one premium bar actually say we just once I just away. See how many you can say. Bisa say one premium no ekosi saying and now many can say ebusia ya increasing national health insurance no ko ya increasing by 120%. Then ekoswa ebusia Ghana for kasa Ghana for diara papa na Ghana for afi na Danko Akufo I think Dr. Mahmoud Bawumia abusia for mama nkwa na nkwa tie nsema Ghana for bi eka efa folder nsem na start say bobo ba no embra
mama can say me only hospitals all Ghana nyina say omo reverse back to manual system. I didn't know until this dawn. But the Mabre Wako Hospital 4 a.m. today. Now Kwako Jedru meant for diabetic patients. Kumasi Central Hospital to be precise. Now you could read and a lot of them were wailing. And me a pinching where Buza said the asema. Say to say no first now about the card bar. Ketwana bodia and one ticket there you go through the process no. See there ukwa ya OJ card for and send you folder there so back to the manual system. So the first one kwa near search for folder near there no. To be to meet after we are most charge you 10 Ghana cedis because a manual system and you have to pay 10 cedis. A lot of people in penifo ye biwo infear the okno, infear the watching, infear the son in termo ho nyina. My mom is over 70 years. Some of them could not pay the 10 cedis. Why do you say 10 cedis is kakitu ebi debi Oko hospital no. Onim because all these years Oko hospital and also boni di and insurance nyina linked to the system. Tomo for insurance kwa bonko. Now on sanso into 10 cedis bia and it became an issue for one old man be. Say yesini wa for insurance card and because of that no. And was see there be on insurance non farmer and they say no system they can't go into the system to look for the insurance number. Inti ebasa umbehe ni I just say utieska. And 10 cedis in the insurance, so you have to pay 10 cedis just for the card. Na yetime you folder the amount. But papa ne de ne because the insurance ni yentime search wa system so intino. Just say utieska na so connect for waba. And I was like, what are we doing to ourselves as a people? Politicians no edin kwasa sembe. In fact, Ministry of Health headed by Ira Kwabra Menta Kando. Omudin kwasa sembe brebe. And ane na some be ya dia ye ne oti omam ye ho be kire ye nkokrafo ne ye mrewafo yi e ko hospital. They also have to go and struggle because you feel that somebody awarded a contract that was not transparent or whatever. Go and deal with the person. Why should we suffer? So if you take us through, or if you take our aged ones through this, before you award another contract for somebody to come and collect data and give another software, why are we doing this to ourselves? And we as a people, we are not talking enough. We are not making noise enough. We are not letting these politicians know that the things they are doing and yes, I defend it, say, oh, there will be a discount, will be a say. Go and deal with those that you feel have sidestepped the system. Now, yene the yenyama niema contempt that if the hospital was actually networked, let's go back to that. Now, yenya size will be a dear, and yet all of this will come back to hurt us, the ordinary citizens.
President John Dramani Mahama nti wo health minister Akando no umpamu Akando up to now who say Akando no adwuma na wo dey man no ontumi nye up to now honorable Akando cannot do the work ontumi pamu no na minister Ben hwe obi a wo se wo farmer and na man fa agri minister mano and then you hey God Ghana ye be bro na our health ya pum di na mudi di agoro sa no ya pum di na mudi tu chacha ona ba kando ejuma no tumi nya jai na mbi foforo mo fa ma obi foforo me nkase mo fa ma MPP ni o mo fa ma NDC ni foforo no betuma ye ejuma no. But because the way our niamani kon, it is very clear say the way you can't do it. And ya kasa wo ejuma na ye dia hye won sa no you can't do it. What to mean ye? And a President John Dramani Mahama, this is your last chance in this country. Leave some legacy. And you are going to allow these people to spoil your legacy. President Mahama.
I am begging the President, His Excellency John Dramani Mahama. Mr. President, do not listen to your health minister. Do not listen to what your party people are saying. Do not endanger the lives of your citizens. Do not risk it simply because of propaganda, because of politics, and probably because of procurement interest. And now listen, we need to establish certain facts. And of all the things you will discuss this month, trust me, none is as important as zipline.
Really?
Because if you understand what zipline is, and understand what zipline does, you would realize that it is something that we should not even be discussing it and treating it the manner in which we are right now. First of all, I hear the conversations and I can easily point out the absolute ignorance of what really zipline is by a lot of the people making the commentary. People assume zipline is just a substitute for unavailability of hospitals and health facilities. People assume zipline is a substitute or just an alternative for unavailability of drugs in these hospitals. And so I hear people make the argument of if the drugs were available, why would we need zipline? Instead of having zipline, why don't you build hospitals? Why don't you? And that straight away tells me that, honestly, sincerely, they do not understand. And for me, I think that one of the responsibilities we have is to also make sure that it is explained very well so that people can make informed, commentary about it. I've heard a lot of people, and clearly you can tell. Because immediately you are discussing zipline and you talk about building hospitals, you talk about unavailability of or supply of drugs that I know you don't understand what zipline does. Let me say fundamentally, there is no substitute to zipline.
Really?
Zero.
Really?
Hospitals, building hospitals is not a substitute to zipline. Having medical stores is not a substitute to zipline. If you want to understand zipline in its basic terms, probably look at it as an ambulance in the air. That is probably not carrying human beings, but carrying the medication to the human being that is under duress. You see, there was a time in this country where snake bites were killing people.
Sure.
Just snake bites. there was a time in this country where maternal mortality rate was so high, simply because in the middle of the night, 2 a.m., 3 a.m., when the woman is, I mean, like they say, water is broken, they need blood. And where they are, blood is not readily available. And people were dying as a result of that. Nana, these and many more are the reasons why zipline was introduced. Remember also that in all of these conversations, there are multiple things that connect to it. So, before I even come to all the other issues around it, I want us to establish the fact that there is a background to the establishment of the zipline drone system. And this is not politics. This is human lives at stake. This is the health of our country at stake. Fast forward, when the zipline was being introduced, people actually played politics with it. But still, I insist, those things for me are still not relevant. Because my view is that if the person doesn't understand, the person is free to have those kind of conversations. So I remember when zipline was being introduced, people said that it will capture videos of women bathing and all manner of things. So if the same people come to office and they go after zipline, I understand. But I'm 100% convinced with what I've seen with my eyes, my experience with zipline, that these people really do not understand what zipline is. And so they say, why are we spending 170 million on zipline when we can use it to build hospitals? Ignorance. And I'm begging the president. And for me, I'm glad Hamza is here. Our health system is something that we shouldn't tamper with it at all. Leave it. Go and bring, see, you can go and bring whoever you want to bring. When it comes, cancel the existing one. But at the moment, you've shut down the existing systems. And do you know the impact? People are dying. The report is here. Because people are not getting the essential medications that they need on time. Now, the argument they make is cost. Listen, we are spending 297 million every year to supply sanitary pad to school children, including me, my niece in Latte, that can afford sanitary pad. No problem at all with it. It's a social intervention. They deserve to have it. So keep it. The same way you are able to commit to 297 million to supply sanitary pad that we all support, spend the 170 million to also provide zipline. That is also saving people 17 million medications delivered. Now let me land, I beg you. 17 million medications delivered. So cost shouldn't be an issue. Is it not the same government that is debating us that he can still construct an expressway and at the same time complete a highway? And that those of us saying that he should finish the highways first before he goes to the expressway, we are unbelievers. So if you can actually complete an expressway and a highway all at the same time, we beg you, Your Excellency John Dramani Mahama, let's keep 297 million for sanitary pad, and let's keep 170 million for zipline. If you think it's too expensive, go and bring those who will give it as a at a less costly, price before you terminate this. But at the moment, the risk is high. The argument about we can use the money to build hospitals is complete ignorance.
December. This was after the NDC has presented their exhibit, what we refer as Exhibit A, to confirm from Ghana Publishing that the date that the parliamentary elections were gazetted was 24th. So that ended the matter. The chairman, there is a reason why under PND's law 284, the representation of the people's law, it is stated in section 18 that before a person can take a matter to court, first, the electoral commission should have gazetted the election results, then after 20 as to why we lost the elections. They submitted their report. And after they have submitted their report, the party immediately constituted an amendment committee chaired by Lawyer Frank Davis to look at the various aspects of our constitution that needs amendment and those areas that have not been captured by our constitution to bring the constitution in real time to deal with current and future situations. Mr. Chairman, I'm proud to say that many of the issues which in one way or the other culminated in our loss on December 7, 2024 has been addressed in this amended constitution. We all know that one of the reasons why we couldn't get the needed votes to win our elections was apathy in our party. And it also stemmed from the fact that there were several former party executives who felt that they were neglected because they were former executives. But in our current constitution, I'm proud to say that we have expanded our electoral college to make room for former party executives, at least at the constituency, regional, national level, and even former members of parliament to have a voting right. All these are done to address the issue of apathy in our party. You also recall that in the elections, many people criticized our party communication. And there were issues that done so much, but we were not communicating our achievements, and there was lack of coordination even among the various communication directorates. Mr. Chairman, I know our revered historian and authority on constitutional law is here, Professor Iroma. But Prof, you agree with me that one of our shortfalls or struggles, even from our forefathers when UGCC was formed, had always been on how our tradition been able to deal with propaganda and lies from our opponents. At least, I'm proud to say that with this new constitutional amendment, we have painstakingly looked at how our communication has been run in the past, even from the time of UGCC to date. And we have made reforms to make sure that we address issues of communication and prevent our opponents from always going with propaganda against our party.